Can you please, I know you're a big proponent of the Medicare for all. How is it different from Obamacare? And can you elaborate on your plan for healthcare reform?
You don't have to be 64 to qualify for it. You are qualified from the moment, from before birth, actually, right through from cradle to the grave. Right now, Americans pay more than any other developed country, yet we have the worst health statistics of any developed country as well. By moving to Medicare for all, we ensure that all of our tax dollars for health care are actually going for our health.
Can you please, I know you're a big proponent of the Medicare for all. How is it different from Obamacare? And can you elaborate on your plan for healthcare reform?
Absolutely. So our plan is Medicare for all, and what that is basically Medicare, but it's expanded. You don't have to be 64 to qualify for it. You are qualified from the moment, from before birth, actually, right through from cradle to the grave. And Medicare has very low overhead. It's about 3%. The overhead in our private healthcare system is about 30%. So right now, Americans pay more than any other developed country, yet we have the worst health statistics of any developed country as well. So we can do much better. So many people now can't afford health care. They're priced out. They don't even have health insurance. So there are many things that we can do. And Medicare for all cuts the cost of health care. Right now, 1 out of every $3 that is spent on health care actually doesn't go to health at all. It's spent on paper pushing and bureaucracy and red tape and big CEO salaries. So by moving to Medicare for all, we ensure that all of our tax dollars for health care are actually going for our health. And we can then expand health care to cover everybody and to cover everybody comprehensively. Because right now, things like mental health care, your teeth, your eyes, your hearing aid, reproductive health care, so many aspects of health are cut out. They're not provided at all. Chronic care. If your parents need intensive support, instead of having to send them to a nursing home, you can actually get support for them to stay at home and have care there within the family environment. So it's a far more humane and quality system. And because of this huge savings in the overhead, we save over $500 billion a year, even after the healthcare has been expanded to cover everyone comprehensively. So it is a win-win.
Yeah.
Now, the president cannot pass this by executive order. The president can propose it. This is where the president has to act as an organizer-in-chief, not just a commander-in-chief. Fortunately, the American people strongly want this bill, and they've been quite educated about it, and in polls generally support it by very strong majorities. So this is where we need to bring back the power of the people, and we need to have town hall meetings. We need to be exposing the representatives who are not meeting with their constituents. We need to be holding public hearings so we can actually cover what the healthcare crisis is, and we help bring the power of the people to bear on our congressional process. Right now, it has almost nothing to do with the congressional process, which is mainly driven by money and lobbying. That is a separate issue, and our hope is, we'd like to pass a constitutional amendment and get private money out of politics altogether, repeal Citizens United, provide public funding that puts candidates all on a level playing field so that they're competing in the area of ideas, in the area of policy, instead of competing for who can raise the most money by selling their soul to corporate America. So we need the change to the system, but that's not going to be the first thing that we get passed. We're far more likely to pass health care reform first because the American people are engaged on this and are highly, motivated right now to become very involved in the democratic process and force it through basically grassroots mobilization.
নিউ ইয়র্ক থেকে সম্প্রচারিত টিভিএন 24 টেলিভিশন বিশ্বজুড়ে বাঙালির কণ্ঠস্বর।